But we'd like to hear from you, what is the status of women actually, women's health in the Philippines?
Okay, let me start with women's health, because women's health, sometimes it's categorized as reproductive health,
Yep.
but these are two very different things. Women's health is much broader, although sexual and reproductive health is a big part of it. And when you talk about women's health, you expect, like, we have a vision of what the gender differences are in health between men and women across the life cycle, no? Mula sa infancy, ano ba yung common conditions hanggang sa tumanda? What are the different conditions, and are they affected equally? Unfortunately, we don't see that. We don't see that in the Philippines at all. We see reproductive health, or bits of it. So we see maternal mortality. There are claims that we have improved maternal mortality, that it is down. But actually, when you look closer at the figures, and they're using the figure of the WHO, which is 114, which is lower than the PSA figure of 221. So those are big numbers, but the Philippine government wants to see it as low. But when you even use that figure of 114, you can see that we have not progressed from 1990 to the present time. So maternal mortality, and that is the most uncontroversial aspect of women's health. And if we cannot even show a reduction, a significant reduction for that, we were one of the 2 countries in 2015 cited by the WHO as not demonstrating any progress. So how, minus this gender aggregated health status, just basing it on maternal mortality, we have not progressed.
Could you
very
go back
far.
a bit to that example of maternal mortality? Again, the indicators that say that if you look deeper and more closely, it actually has not improved. Could you go back? I mean, just expound on that a bit.
Okay, let's use 114, which is the figure used by the Philippine government, which is very different from the PSA, our own Philippine Statistics Office of 221.
Okay.
So let's say 114
That's over per
100,000.
per 100,000. Okay.
When you look at 1990, our figure was about 120 or something like that.
Okay.
So we have
This is deaths per
Yes.
100,000 deliveries.
deliveries.
Ah.
The standard, the global standard, is there must be a reduction from the 1990 levels of at least 5% every
Okay.
year, per annum. So kung gagamitin mo yung mga 120, we should be down to 30 or something. It's 114. So we haven't really progressed that far. We have progressed a bit by bit.
And that's using government data, not the PSA figure. If you take the PSA figure, it actually became worse.
It's just as bad, because the PSA will show you that we have not really declined significantly.
But how can there be that kind of discrepancy? That's based on Department of Health figures, di ba?
No,
The
these are
government figures?
these are the Department of Health figures are not how do you call it? These are not validated. So subject to big errors. So they use the WHO, which is a model. It's not based on actual.
Could
diba?
it be? I mean, just being trying to find being devil's advocate here, ironically. But could it be that it was in 1990 that data gathering was not as reliable? Is that possible?
No, because the WHO data is not even based on data. It's like a model. It's based on calculations, no? So they have this 1990 to the present one.
So the methodology is exactly...
Which parallels, the trend parallels the PSA, except for the absolute, the figures are different. But the trend of not improving is the same.
But that's 3 decades. Oh, I mean, we would have thought that with technology improvements, improvements in medicine, increases in funding, you should have seen a huge cutback in mortality. What happened in those
Except
29
that technology
years?
it's not the answer to everything. Like, what is like the gender appreciation of women's particular problems, for example. These are the social parts of health that a lot of technology has not been able to solve. No? So, for example, maternal mortality are the women, for example. We see that a lot of women who are poor do not get the services that they need.